Well, good afternoon, everyone. In addition to Dr. Ezike, we're joined today by Matt Charles, our laboratory director at the Illinois Department of Public Health, and by Brigadier General Richard Neely, our Adjutant General of the Illinois National Guard. Today marks 10 days since our last update on testing at these press briefings. If you recall, I used that briefing to highlight our current capacity and laid out our plan to reach 10,000 tests per day, the number of tests scientists and experts say that we need to understand more fully the virus's presence in our communities across Illinois. Folks, I promised you honesty and transparency in every step of our COVID-19 response, so here it is. We have only just recently surpassed 6,000 tests, and we will not reach the 10,000 mark this week. Today, I'm going to lay out exactly why that is, the work that's been done to increase testing over the past 10 days, and what we plan to do to get to our goal as quickly as possible. 10 days ago, I presented a roadmap showing how we were going to get to our goal within 10 days. The path that I laid out for you had as its key element the addition of new laboratory automation machines to add a multi-thousand unit daily increase to our state labs. To get this done, we partnered with a major supplier of molecular testing equipment, Thermo Fisher, which is a global provider of COVID-19 testing solutions to state and commercial laboratories. Thermo Fisher, like many companies, provides testing processes that are regulated by the FDA and are authorized under an emergency use authorization to provide COVID-19 testing to customers like the state of Illinois. So we acquired 5 high-volume RNA extractors from Thermo Fisher, each of which promised to run 200 tests per hour, and we distributed those 5 machines across our 3 state laboratories. Some quick math will tell you that these extractors could increase our testing output by thousands per day when running effectively. Over the past 10 days, working alongside experts from Thermo Fisher, we are still not getting the level of output that we want to see from these machines. More importantly, these tests are not producing valid results in a way that meets our exacting standards. I am as impatient as the rest of you are, wanting to increase testing, but I will not sacrifice accuracy for the sake of speed. These tests and the results they will provide are too important. We have to get this right. We're working around the clock alongside Thermo Fisher to accomplish our goal, but until these challenges are overcome, these machines will not be part of our testing capacity here in Illinois. 10 days ago, I said to you, every day we aren't hitting 10,000 tests or more is another day that we're not able to get the answers that help us get past the current crisis. So today I'm standing in front of you and saying we are not there yet. Folks, I want to be clear with all of you that we are choosing the best path, but not necessarily the easiest path. If we wanted to choose an easy but less effective path, we could increase testing capacity through private labs used by the federal government. The problem is those labs take 7 to 10 days to produce a result. People can end up on a ventilator before they ever get their testing result. That's just not a timeline that I want to bet on. When we produce accurate test results at our own state labs or at local hospitals, we get results within 2 days. No matter how much is beyond our control, the buck stops with me, and we are still not where we need to be on the testing front. So here's what we're going to do. Instead of solely relying on federally sanctioned labs to save us, we're charting our own path forward. I'm putting my faith in the scientists and technicians, the academics and innovators here in Illinois to expand our test results. Our state is nationally and globally competitive in just about every category of research, science, and technology. We've already relied upon those resources in our fight against COVID-19. Illinois was the first state in the nation to validate the original CDC COVID-19 test back in February. In the United States, only the CDC has been testing for COVID-19 longer than the state of Illinois. And teams at universities and research laboratories statewide are already working toward treatments, preventions, and cures. We've already led the way on state-level testing innovation in the United States, and we're going to do it again. Our researchers are working in an expedited fashion to get this additional new testing up and running as soon as possible and distributing it to other institutions beyond our state labs that have our same type of equipment to continue increasing capacity statewide. To ensure a steady stream of supplies, our in-state universities and local laboratories are creating our own raw materials instead of relying upon the global supply chain, which is, frankly, in disarray. Our institutions are developing and distributing their own viral transport medium, known as VTM, and the necessary reagent locally. Hospitals and labs in Illinois that are running low on VTM will be able to access these resources through their local emergency management agencies' resource request systems. We're now running 3 shifts at one of our state labs, with the other 2 moving to match their capacity soon. And more than 96 locations across the state are now collecting specimens. This capacity has brought us the increase that we have already achieved. Today, we surpassed 6,000 tests in a 24-hour period. We also need to talk about rapid tests. As I've told you, I spoke directly with the president and the CEO of Abbott Labs the night that they announced their portable 5-minute rapid test for COVID-19, and they expressed their genuine interest in taking care of their home state. And for that, I am very grateful. They dedicated the supplies to support more than 88,000 tests a month, or around 3,000 tests a day here in Illinois, and we've seen the documentation as to where the distributions of those items are headed. Unfortunately, it is our understanding now that the federal government redirected most of these early tests to private systems without our state input about where the tests would make the most impact. That said, we believe this new test capacity will begin to show up in our numbers as soon as these labs start to utilize their full capacity. Our teams in our state labs also received 15 Abbott ID Now machines from the federal government, for which we're very grateful. And those machines are being distributed to every state in the United States, 15 machines. This could be a huge help, but there's a catch. The federal government included only 120 total tests. That's 8 tests per machine for all of Illinois. But I assure you that we will leave no stone unturned to get the tests that we need to run those machines at full bore. I lay out these obstacles not to complain or to point fingers, but to be fully transparent with all of you as to the challenges that we face and how we are working to overcome them. It's on us. I'm also hopeful that this transparency will shine a light on some of what's taking place across the country and will encourage the White House to remove the obstacles that are blocking our path forward and to work together. Meanwhile, we are using every resource at the state level to increase testing and are continuing to make progress, though frankly not at the rate that I would like. I want to end my portion of today's press conference with some exciting good news. 2 weeks back, we announced a multi-million-dollar Illinois COVID-19 response fund to support community organizations and local nonprofits around the state, working to support the residents who are hit hardest by COVID-19. This morning, the fund announced its first round of grant distributions, $5.5 million to 30 organizations that serve families across 96% of our state's population by providing people with access to food, shelter, health care, help with their mortgage and utilities, and focusing especially on supporting vulnerable populations like our children, our seniors, those with disabilities, immigrants, victims of domestic violence, and others. In sum, these organizations serve more than 700,000 people. In just the last few weeks, the fund has raised more than $28 million from nearly 2,000 donors, and many more rounds of funding will be coming soon. I'm truly grateful that this money is getting out to our communities so quickly. Individuals and families in need of support should visit the same website as the interested donors do, and that's at ilcovidresponsefund.org. That's ilcovidresponsefund.org.